nursing programs we're going to cover is the STNA track. This was leading to the interest in LPN or RN track. So here's our presentation on STNA.
Welcome to the State Tested Nurses Aides program, or as I like to call it, Heroes and Scrubs. With an STNA, you can have a rewarding career helping others and working as an STNA. When you're working as an STNA, you're basically helping people who cannot do things for themselves, such as getting dressed, brushing their teeth, sometimes eating, the way they move, helping people sometimes just emotionally with companionship. If it's in a home health situation, you might be doing some light housework and things like that. STNAs work with nurses and other healthcare professionals to provide care for those individuals, and you are a part of a larger healthcare team. Where do they work? Wow, you can find STNAs in hospitals, nursing homes, also known as long-term care facilities or extended care facilities, medical centers, staffing agencies, urgent care centers, assisted living, medical group practices, group homes, healthcare agencies, and centers for adult daycare and preschool. So there's a lot of job opportunities out there for STNAs. They play a key role as members of a comprehensive care team in a variety of medical settings, employed in all the places I stated. If you work, many of the responsibilities will be the same. However, depending on the environment that you work in or the type of facility, they may differ just a little bit. The job description of an STNA, regardless of the setting, can encompass many of the same duties as I stated. However, they may vary a little bit depending on if you work in a nursing home or at a hospital. For example, working at a nursing home, you're going to focus much more on people's activities of daily living, like the things you did when you got up this morning. Did you pick out your own clothes? Were you able to brush your teeth? Were you able to eat on your own? Take a bath, take a shower, put lotion on? All the things we take for granted. Use the bathroom for yourself. These are called activities of daily living, or ADLs. In a nursing home, you'd be helping people with those, or even in a home health setting, whereas at the hospital, you may help with a lot of those, but a lot of times people in the hospital are just a little bit, are able to do a lot of those things still, or maybe they come in and aren't, but as they improve in their health, they're able to do more things independently, so we kind of switch up what we do. You may take also additional responsibilities depending on your assigned workforce. For example, I used to work as an RN in orthopedics, and a lot of our aides, STNAs, nurses assistants on R4, were able to put up the trapezing. Those are the metal frames you may have seen in movies and on TV, where people are in traction, where they have their broken legs up and their arms up. They would do a lot more vitals and things of that nature. That was a little bit beyond the basic training of just an STNA course, but still pretty interesting if you're looking to expand. STNAs may also be employed as a home health aide and handle many ancillary duties that may not be related to just medical and ADLs. If you work in home health, for example, you may go visit Mrs. Smith. She'll be our hypothetical patient today, or resident and or client, however you want to refer to them. And we go to their house, and she may need help with possibly just maybe helping her in and out of the bathtub a couple times a week. And then also duties you may want to do some light housework, cooking for her. I've done that in the past before I was a nurse. I was a home health aide before I became an STNA, and I really enjoyed working in that environment, get to know people really well. While some of the duties may vary, it's important to remember that as a professional state-tested nurses assistant, I've tested personal characteristics. We hope you are a caring person. We hope you're a person that has compassion for other people, and empathy should follow you whatever your career takes you or whatever career choice you make in healthcare. We hope that these exemplify your qualities. Personal hygiene, some of the things STNAs do. This includes bathing, washing patients, as well as helping them shower if needed. An important part of patient hygiene is assistant grooming, such as brushing patients' hair, trimming their nails if needed. Many patients also need help getting dressed daily. Infection control. Everybody, with everything going on in the world at the time I record this, which is around still at the end of the COVID-19 pandemic, everybody is very well aware of infection control in this time frame, I'm sure. Proper protocol in preventing the spread of germs in a medical setting is even more important. Can you imagine having all kinds of people in one tiny space, living in the same facility, having different staff members come in and out? You can imagine how important it is that we follow the procedures and guidelines from the Ohio Department of Health and from the CDC, and also those that you're taught in your program. And the update to those is at STNA, you will need to stay current on your continuing education concerning the most up-to-date techniques for minimizing the spread of germs and transporting diseases. And we wash our hands, and then we wash our hands again and dispose of soil, linens, and other materials in proper manner. This is important for preventing infection control and cross-contamination between people living. Dietary care, some of the things you may do when you're an STNA. We want to make sure that our patients are eating enough, that they're getting adequate nutrition. Some patients are able to eat on their own, while others require a little bit of assistance, and others you may have to sit and feed. Often as necessary component to nutrition, we need to be aware of what they're eating. If people aren't eating, that's something you need to record how much and what, so that you can make that report to the person you're reporting to. Usually it's a nurse, because that's one of the first ways we detect changes in people and illness. And the sooner we get those reported and controlled, the quicker and the better the outcome is for the person who is starting to have a declined appetite. Administering treatments as an aide, you may be able to handle medical equipment that can include bladder scanners, intermittent pneumatic compression devices. Don't ask me to say that right. This is, you may have been in the hospital. They look like the leg warmers people wore during jazzercise in the 1980s. Am I showing my age there or what? Where they would squeeze your legs, those prevent blood clots in people. We often put those on people that are bedridden. The stretchy hose you see older people wear a lot of times, so called TED hose or anti-embolism stockings. That's something that an aide that you learn to put on. Bedpans, and so forth. You may also help administer treatments such as patient massage. In some of the larger nursing homes, they employ STNAs that go around and do nothing but treat people to keep them from getting contractures. They work with occupational and physical therapy, and they go around. It's called a restorative aid, and they do range of motion with people to help keep them mobile. Reporting. As an STNA, you will have a direct contact with patients daily. If you're working in a long-term care facility, you are the staff member that spends the most time with any of the residents. Usually a team of 2 STNAs has about 25 to 30 people. A nurse with 1 nurse, RN or LPN, will usually be responsible for 25 to 40 people, depending on the level of care and what kind of facility you're in. You are our direct contact with those patients. I've often said when I teach that often I'm only as good a nurse in working in long-term care as the aides that I work with. What do I mean by that? As you're the primary person that's with them, the more you tell me about what's going on with them that is outside of their normal day, you notice they're not eating well, you notice maybe the beginnings of red skin and a bed sore or blisters, or they're maybe having some signs of depression. When you tell me that, because you've spent that time with them, I am able to focus more in on that area, whereas I may be spending one of me with 40 people. I would not know that maybe necessarily, but you know, as you do things with them during the day and you're taking care of them, you're able to see that. So the STNA is, in my opinion, the most valuable staff member in long-term care. Others may not agree with that. I do. You're going to plan and keep a record of that. You're going to go and let the nurses know anything right away that seems out of the ordinary. You're going to record what they eat, what they're voiding and urine, peeing, what they're pooping. You'll communicate and record with other shifts of STNAs that come in, kind of let them know what's going on, and whoever else that you're required to report to. The more we talk about emotional support, let's talk about this. In addition to giving people physical care, we think it's important that we also take time to see the person that they are. Their emotional needs of patients must be taken into consideration. I can teach just about anybody to do STNA duties and to do nursing duties, but I can't necessarily teach you how to be a caring person. I would hope that would be something that drew you into this profession in the first place, or an interest in healthcare overall, you spend the most time with them, as I said. So while you're doing things like brushing their hair and combing their teeth, talk to them. Look around their room. Do you see the things that they like? Do they have sports stuff up? Do you have a lady that loves cats? Whatever it is that they're kind of into, talk to them about that. Even if they're a person that can't verbally speak back to you, they can still hear you. Can you imagine how scary it would be to be alone and isolated and not have anyone ever actually try to have a conversation with? Even if you perceive that person to not have that ability or not, oftentimes they do. So I always ask people, what is it more that you bring to the table for people? Those are the people that are outstanding healthcare professionals in any instance. There are a variety of ways that you can receive training as an STNA. You can get trained in some healthcare facilities offer programs. To become certified as nursing assistants, you can find programs with the Red Cross, community-based organizations, or community colleges like Owens, and some other of the high schools and vocational schools offer training. There's a lot of venues out there. It kind of depends. At Owens, there's two paths here that we normally offer. We have academic branch, which offers 3 college credits towards your healthcare major of choice and your certificate of completion that a lot of you need for right now at the time of recording this. Is needed for all the medical imaging. LPN, RN is a file requirement for your programs. Before the time you go to clinic, the student can find at the end of this can sit for their state tested nurses exam as long as you complete the course with an 80% or better. If you're going for college credits, it's worth 3 college credits, and financial aid can be used to fund this pathway. The second one we offer is to workforce, and that is for non-academic based, which means there's no credit offered for it, but it is a much faster paced course. It's looking for people that are just want to be STNAs and want to get into that as a profession, and we get them through quickly and we get them over for their state test. And oftentimes you can find a nursing home or hospital that's willing to fund your training if you call and ask. As an STNA student, you learn a lot during your training program. We teach you how to provide quality care for your patients. You learn how to take vitals and identify potential problems, and that should be reported to a nurse or doctor. And when training to become an STNA, you will learn how to help patients do their activities of daily living. Remember I talked about the hair combing and the teeth brushing. It may sound simple, but man, I'm telling you, a lot of these things are not easy to do. You might have somebody who is a larger person, and you may be a smaller person, and they're wheelchair bound, and you have got to get them from a wheelchair to a bed, and there's you in a lift. You're going to have to learn how to do these things without hurting you and without hurting them. We want both people to come out with a good outcome. You often, like I said, you're going to be learning, helping people with their daily activities, depending on what their STNA training will teach you how to provide excellent bedside manners. What do I mean by that? How to effectively communicate with patients in order to provide them with the highest level of care. You may have people that have visual disability. You may have people with hearing disability. You may have people with mental disability or developmental disabilities. You may have people that at one time were what we would consider to be normal, not have any disabilities going on. What if they have a stroke or they develop Alzheimer's? Or they come in and they may be somebody that's talking to you, and over the course of time, because of whatever health condition, they lose those abilities. You're going to have to learn how to adapt and communicate with people. That's one of the things I ask, like, what do you bring to the bedside? We can help you learn how to do that and take your caring and turn it into a very effective tools and training that you can become very good care providers for these people. Typical day of an STNA training includes coming in and the program, and whether you're attending classes or the clinical experience, you can do that either full or part-time at Owens. We offer 8-week and 16-week options. Some programs can be completed in several weeks, while others take several months, depending on what your work schedule is. I kind of like the 8 and 12, 16 weeks because it gives you an ability to work around whatever you've got going on outside of STNA class. Which is usually quite a bit. Family things you need to get done, and you may be going in other classes and things like that. In Ohio, any nurses aid training program, that's NATCEP, that's Nurses Aid Training and Competency Evaluation Program, must include 59 hours of lecture and skill. That basically means you come in at Owens, a typical day is going to be 6 hours. You're going to come in, you're going to do first 3 hours of lecture, you're going to get about an hour break for lunch, and you're going to come back and you're going to do 3 hours of hands-on skill practice in our lab. With a partner, we have beds for everybody, we have lots of equipment, the lifts, the mannequins, that all simulate patient care in a clinical setting. At the end of all that training, at the very last 2 days of your class, you're going to go for 16 hours of hands-on clinical experience with one of our many excellent community clinical partners. We got sites at like ProMedica and some of the larger like Kingston and many Orchard Villa, many of the large, well-known long-term care facilities in the area. We have contracts with, and you will be placed in one of those for 2 days of hands-on care with actual clients, and pretty exciting to do. Some of what's covered in class. You'll learn basics of anatomy and physiology in order to help you understand how to care for patients. Your classroom instruction will help you be prepared for the time when you go to clinical. So you take all those skills that you learn in the lab, how to move people, how to do things. There's 25 of them, and take what you learn in application in the class and in the lecture, like how to talk to people with Alzheimer's, how do you deal with different behaviors, how do you feed people with different disabilities, and you're going to take that at the end, put that all together, and do a hands-on clinical-based training. Much of what you learn in the classroom, you're going to practice for those 8 hours, 2 8-hour days that you're there. I find that most people learn the most, or they come back and tell me after that what they liked the best was the actual clinic. That makes me feel great, because that's what we're trying to do, is turn out people that are enthusiastic to help and take care of other people. It makes you feel great when you can go and take care of people, and you feel like, at least for me, when I feel like I've done something to give back to my community and other people, you're going to go and do that during your clinic. When you do that, at the end of that, and you score that 80% and you have that clinical experience, you're going to get mailed to you a certificate of completion. That's the file requirement for most of you. And then I also mail out this would be for any STNA program, a paper that tells you where to go online and register for your test if you're looking at becoming a state tested nurse's assistant, and how to schedule and what that would entail. In the lecture component of the class, I want to talk a little bit more about that. You're going to learn about charting, medical ethics, what you're allowed to do as an STNA, what you're legally allowed to do, and what you're not. Unfortunately, sometimes aides are asked to do things that are outside of what we call their scope of practice, or what the state says that we're allowed to do as a nurse's aide. Very important that you learn this. Even if you're going to like nursing and you don't think you're ever going to be an aide, you're going to be a person that is delegating to nurses aides. So you're going to have to understand what their scope of practice is. So you're not one of those people and supervisors that ask them to do what is outside of their scope of practice. You need to learn about different disease processes and the care for people in special populations that we talked about. You're going to learn your place in the continuum of care. You're all sitting in an interprofessional education course for a reason. This is a great way to understand how each person brings, different profession brings their scope of practice and their view and their training into a situation to help care for a client. For example, we have a patient who has a red patch of skin, say on their lower left leg. The STNA is going to notice that when they're taking care of it. They're going to come and report it to me. I'm going to look at it and think, wow, okay, I'm going to talk to the doctor about it, but I'm also going to look at it as a nurse. Are they rubbing against something? Are they not getting turned in bed every 2 hours as required? Are they bedridden? Have they bumped into something? Did they fall? We're going to start looking at all these things. If we found that maybe they're rubbing their wheelchair, that is obviously something I can know about, but as a nurse, I can't fix the wheelchair. So I would report that to physical therapy and occupational therapy, and those departments are going to look at that wheelchair and how to modify it. You see how we work together? But it came from the Aide, the initial report. So those kind of things are very important. For your state test, and the part where we do the skills portion of the test. In the classroom, you're going to learn, I talked about those 25 different physical tasks that teach you how to safely and properly care for patients. That is the 25 skills I'm talking about. Go to take your state test if you choose to test. There is a course written part of the test where there's questions. There are 79 questions that test over all the material that was covered in the lecture. You have to get a 75% on the written test and an 80% on the skills test. So there's actually, like I said, two components. So you got the written one, and then you're going to be taken to another area on testing day, and you will get 5 skills out of those 25. Everybody gets hand washing, and then 4 others of the testing centers choosing. So that's very important to know, and you got to get an 80% on those. So say you go and take your written test and you pass that, but you don't pass your 5 skill tests. You are allowed to take each section of that 3 times to pass. So that's interesting. So if you pass one section, you only have to redo the other. Of course, if you don't pass either, you got to redo both. Most of it, that does it. It's pretty good. I think the state average is about a 73% pass the first time through. So if you do have to go back and do it, not that big a deal. That's fairly common. When you do have successful completion of the classroom and clinical, at this time you're considered a certified nurse's assistant. So when you complete my course at Owens with an 80% or higher, that's what the state says you have to have in the classroom. You're going to get a certificate of completion. That's what you're going to need for your file requirement that I talked about. But if you want to go work as an aide, you can go get employment as a state tested nurse's assistant for 4 months without needing to pass those written and skills exams, and work to become a state tested nurse's assistant aide for state tested nurse's assistant. For 4 months without having to pass your exam, which is pretty useful if you're looking to practice in that before you go for your skills exam. This slide here, the state test, what to expect. Again, it's 79 questions and 25 skills. I already covered that, so I'm going to kind of. All right, just a recap. Nursing careers. Certified nursing assistants, median salary, $24,000. Hourly, national average is 11.54. Now, I do know if you go to the hospital or some of the larger nursing homes, this is quite higher. I think the highest, I won't say where, not very ethical of me, that the highest hourly rate I've seen for an experienced nurse's aide is about $15 an hour, which isn't too bad. This is a great stepping stone for anyone looking to go once they know they want to go into medical field, but you don't know where you want to be. My advice for these people would be to go get a job as a state tested nursing assistant. Go work at the hospital. You are going to see occupational therapists, physical therapists, nurses of all kinds, specialty nurses, physician's assistants, doctors of all kinds. You're going to see the medical imaging people. I mean, you're the social workers, and you're really going to get an idea of where it is you want to be, because often what you think different professions aren't actually kind of what you see on TV and that. I know that sounds funny, but when I went to become a nurse, what nursing was and kind of what I thought it was at the beginning were a little bit different. You may find that to be true. Another good thing about becoming a certified state tested nurse's assistant, taking that test is while you're in school, especially if you're going for nursing or any of the others, you can go get a job and start working in the healthcare profession while you're in school, and that will count towards some of your experience for quite a few things. Kind of gives you that foot in the door experience. So if anybody has any questions, please email me at Jill, Jill_Weiland, WEILAND @owens.edu. Thank you.